Okay, I think we should be live. Let me just confirm. Okay, cool. I think we're live. So welcome everyone to yet again another Let's Talk Disability Live on Facebook. Today's conversation is about disability and economic participation in the context of inequality. And today we have some really awesome guests that we are so excited to have this conversation with. We are here with Lydia Pretorius and Zuki Swanzo. So before we start this conversation, this week we have received some terrible news about the loss of Dr. Vuyo Mahlati, who has been a big contributor in our community. And so I'm just going to hand over to Lydia to share a few words before we continue with our conversation. Lydia.
Thank you, Beauty. Colleagues, as Beauty indicated, we lost Dr. Vuyo Mahlati this week very suddenly. And I think a lot of us would have heard her tributes to her on radio, etc. But really focusing on her last years, it's sort of the last 10, 15 years. But in the disability sector, we got to know Dr. Vuyo Mahlati as a newly qualified therapist. When she worked with parents initially just in the Western Cape and in Cape Town and later on countrywide and later on internationally, in rallying parents around with children with disabilities around the rights of their kids, and that they didn't have to accept the status quo of exclusion and of marginalization. And she felt very passionate that the rights of children with disabilities is directly related also to gender rights. And women in particular, because it's usually the mother or the grandmother or a sister that would carry the brunt for care and whose lives get disrupted because of the lack of facilities available and opportunities available. So it was really her beginning years as a gender activist that was shaped by mothers of children with disabilities. And once she had managed to, and her mission was really to ensure that children with disabilities would benefit and their families would benefit equally from democracy in South Africa. Once she had helped to establish the Disabled Children Action Group, she handed it over and she said, my job is done here. I have full confidence in the abilities of parents. And she then moved on her work as a gender activist, but always remembering where she started, always remembering that some people get left behind much easier than others. And I think disabled people in the Western Cape at Vukohambe and then would be able to testify to the work that she did. So we never forgot the work that she did. We never forgot that the impact that she had on the movement as a whole. She was instrumental in ensuring that parents of children with disabilities get full recognition within the disability rights movement. So about 2-3 years ago, when we were celebrating the 30th anniversary of the disability rights movement, etc., we invited her to join the panel, Oliver Tambo series, to join the panel to think back and to see how far we have gone. She did not hesitate. And I think for me, dedicating today to her is her role as not only a disability activist, but as a gender activist, as a human rights activist, and as an economist, really speaks volumes. And I just felt that we need to pay tribute to Vuyo for her early years in this week of a funeral and of all the memorials taking place. Thank you, Beauty.
Thank you so much, Lydia. Yeah, I think it's very important to honor people. So it's awesome that we get to do that today. So before we start, could you guys please introduce yourselves? Anyone can start.
Suki, over to you.
All right. Hi, thank you so much, Beauty, for inviting us to be part of this conversation. And I'm very pleased to be sitting alongside and conversating with Lydia. And that was a wonderful tribute that you paid, Lydia, to Dr. Vuyo. To introduce myself, my name is Zuki Swa, commonly known as Zuki. My surname is Nzo. I myself am a wheelchair user, which means I'm a disabled person. Who is passionate about economic empowerment of disabled people, amongst other aspects of disability inclusion. So I'm a practitioner on disability and inclusion.
Thank you, Zuki. Lydia, over to you.
Good day to everybody. I'm Lydia Pretorius. I started off in the disability sector as a therapist, but quickly left that and then became a disability activist quite early on in my career, really with a focus on rural areas. Give me a rural village to live in every day and I'll be happy. I'm not a city slicker. And I really was taught disability by disabled people and parents themselves. What the university taught me was very little in what I use today. I was really taught by persons with disabilities and parents under trees, at road crossings, because that's where the taxis kind of sort of crisscrossed. So yeah, I then worked for government for a while. I helped to draft some of the disability policies. I was a deputy mayor. I was a chief of staff in the premier's office. I was mainstreamed for 11 years before I came back to the sector. And then the end of January, I left government because I just felt that my roots is in NGO, my roots is with people and communities, and we need to get implementation going. So that's, and currently I do consulting work and I'm a life coach.
Awesome. I'm so excited to have this conversation with you guys. Like we said, today's conversation is about disability and economic participation in the context of disability. And where this topic came from, I think, you know, we were talking about, and I guess it was after our previous session where we had Brian's mom on the show, and we were talking about seating. And so that was an incident where Brian Diamond sustained, you know, injuries via gang violence. And, you know, from being in conversations that were reflecting on the conversation that we had in our last session, I thought, oh, like, actually, what makes people vulnerable to violence, or what contributes to violence? And so we came to, you know, think about economic participation and what that means or looks like for people with disabilities and their families. So I'm just going to ask questions and let's talk. So the first question that I want to ask you guys is what actually is economic participation or opportunities? So when we talk about economic participation, what are we actually talking about?
Zuki should actually go with this. She's the economist amongst us. So she understands the economy better. But maybe I should just open by saying, we often measure economic participation as the economically active population. In other words, those that are actively seeking work. And the reason I'm kicking off with that is that if you are disabled and you face a lot of barriers into the economy, or if you're a mother of a disabled child and you have to look after your child, you are not actively seeking work, so you are not even counted in terms of economic participation. You just go into the faceless, numberless, nameless, statisticsless group of the population that's not economically active. And the other part that I want to just touch on is that what's economic opportunity? Because economic participation is an aspect of economic opportunity. And that opportunity component is the equal opportunity, is the equal part also, because it also includes the remuneration gap. So it's the participation gap. it's the remuneration gap, and then it is the advancement gap. I think anybody that's disabled and that has been stuck at the entry level into a job for years understand the advancement gap. Anybody that does the same work for different pay just because they have a disability understands what remuneration gap is. So while we often look at remuneration gap from a gender perspective, there's a massive disability remuneration gap also. So I think for me, that's all I want to say at this stage. Thanks.
Awesome. And you, Zuki?
Yes, thank you so much, Lydia, for opening up with that. Yes, as Lydia put it out there, the strict definition is basically the labor rate, the total active population, those that are actively seeking work and those that are already employed. But because of the topic of today, we're trying to look at disabled people, and Lydia added another component, or rather attribute. For me, I tend to want to, for impact's sake, I tend to want to focus on economic empowerment and not only economic participation, because strictly put, participation only speaks about the labor rate, as in the number of people that are active, that are working, which means an indicator of that is most likely to be more quantitative, meaning that the number of people that are actually working. But when it comes to the situation of persons with disabilities, as Lydia, or any other marginalized group, as Lydia has pointed out, there's got to be an opportunity first for those people to be able to participate. And that's the precondition for economic empowerment. Sorry, I'm switching, I'm speaking about economic empowerment. I am not trying to nullify the participation. It is necessary. It means that people have already stepped in. They are getting the job, for example, but are they truly empowered? You know, that's the question. Because the fact that I have a job does not necessarily mean that I'm empowered. I'll elaborate when it comes to disabled people. Lydia mentioned the opportunities need to exist. Opportunities can be in the form of policies and programs. And in our country, we do have those, the BEE policies, that are trying to encourage the participation of marginalized people as well as disabled people. But now, say this person has now gotten the job, right? You find that, this is based on the research that I've done, you find that people do get the job. However, because the playing field is not level, a disabled person finds themselves disadvantaged against their counterparts, where they experience factors like transportation barriers, accessible transportation barriers. So now you've got the job, but you've got to get to the job, but you can't get to the workplace because there's inaccessible transportation. So there's got to be equity measures that are put in place in order to put you on the same field as everybody else. So as I'm saying, participation is not enough. You know, there has to be other elements that are looked into in order to ensure that someone is empowered. And when you look at the conditions such as, sorry, I'm just going to wrap up quickly. I know it was just a quick question.
Go ahead.
And then when you look at opportunities as well, in our country, we've got like BE policies, right? But now you'd find that this disabled person has not got the job. She can't access accessible transportation, and as well as they don't have career advancement, but they've got less career advancement opportunities than their counterparts, because the policies are in such a way that when you look at the BE, the target is set as a certain percentage of employment at private company throughout all occupation levels. But when it comes to women, or when it comes to other groups, you will find that the targets are set at top management. You know, there's a target that is set for top management, participation of women, middle management, and so forth. Now, we have found there's evidence that shows that policies of this nature leave disabled people at the lowest jobs, which makes it difficult for them to advance. So there's many other factors that I could touch into, but I just wanted to expand on, yes, participation is okay, but it purely means that the person is now active. It does not necessarily reflect the true empowerment of the person, and it doesn't translate to how they live their lives back home.
Yeah.
Mm.
Wow. I appreciate the depth that you guys have gone into, because when I asked, or when I was thinking about this question, definitely did not have any of the detail that you guys have expressed in mind. So I guess what I'm hearing from you guys is that so there needs to be like opportunities so that people can participate, but then there's another step that we haven't even started to talk about, which is the empowerment aspect. So so what does economic participation, and I think we can bring it also into the conversation, economic participation actually look like for people with disabilities? So I'm talking about, what are the barriers and what are the facilitators? Yeah.
Maybe if I can elaborate further, because Zuki sort of took us into it. In the disability white paper, we distinguish between access and participation. And the access is what would then, you'd be in the labor force and you would be counted. But there's access challenges, why people don't even get into economic activity. And I think the other thing that we must also dispel is that economic empowerment, economic participation is only as employees. It is also as owners of the economy, it's also as employers. So it's not only, we must stop seeing disabled people only as employees, but also see them as employers. And that's also economic participation. And I think for me, in terms of access, if you have a visible disability, you are likely to face discrimination in accessing economic opportunity. When people would look at you, they make a judgment, they decide what your value is, and they decide if they want to take it on or not. I think the second part is that whereas if you don't have a visible disability and you don't declare, so you get in, and then you're unable to participate because you need reasonable accommodation, and that becomes then a different story. Same with schooling. Kids that do not have visible disabilities get into the school, but the moment they start falling behind because they don't have the enablers they need, they drop out. And the same happens in the economy. I think the second thing for me really is the skills and qualifications. Too many of our disabled kids are still graduating from special schools. And special schools which do not necessarily give them the skills and the qualifications and that they require to take them further in life. And I'm not saying all special schools are bad, but I'm saying too many of them. Where you remove your child from home, put them in a school where they're supposed to access all these wonderful things that enable them to learn better, and they don't get it. Yeah. But even in our mainstream schools, the children don't always have access to the subjects that take them further, where they can further acquire post-school education and that they can actually get ready for a career. They don't always access the life skills that they need as a disabled person, because you require more life skills, because there's more negotiation, there's more conflict management, there's more tenacity, there's more resilience needed, because life is a struggle. So are our schools, both mainstream and special schools, really equipping our kids for the economy? And not just for the economy of the past, but really the new economies. So that becomes an issue around skills and qualifications. And I think from a parent's perspective, and I think it's really important that we always see disability as a family thing. It's not just the individual, the entire family is affected. So from a parent perspective, that burden of care, and I call it burden because it's the parent alone with the child, there's very little support. That's burden. It doesn't have to be burden. It can be the joy of care if the support was there. So, those care responsibilities also becomes a barrier to accessing the economy, to access your own company, owning your own company, to accessing employment. That's for me the access issues. And then, as Zuki said, your transport issues, your external issues. It's all good and well to have a My City or a Rea Vaya or Arieng or a Go Durban or whatever, or Harambe, all these BRTs. It's all good and well to have these accessible transport points. But if they're not from door to door, you don't really have access, because the environment in which they are running is so inaccessible. But the second aspect, I think, that really becomes important for me is in the participation costs, the participation challenges. So I get the job, or I own my own company, I open it, and then my cost of participation compared to my peers, the additional transport costs that I now have to go into because I need somebody to get me to work, or I need to pay extra for my wheelchair. I can't walk the distance that my peers are walking, so it costs me more. The wear and tear on my assistive devices, and I will later come back to this from an economic justice perspective. The accessibility in the workplace. Not just in the workplace, in the training opportunities the workplace gives, and being able to do career advancement because you can't go out and see clients. So they kind of pigeonhole you, they make your little corner accessible, or they give you your computer equipment and they think they've all done it. And then the last part for me is the discrimination part. And I raised it earlier on in the remuneration gap. A lot of disabled people do exactly the same job and their paycheck is less. So that's one of the discrimination aspects. But there is another discrimination for equal work for equal pay, depending on whether you take the take-home amount on the paycheck or what is disposable income. If I have to pay a lot of money extra just to be at work, it means if I earn exactly the same as my peer, I'm still poorer than them. I actually still have less to spend. So for me, those are some of the issues. There's a third aspect I just want to introduce. So there's the employment, there's the employer, me being either. But for economic participation, there's another aspect for me. And this is an area where Vuyo Mahlati actually did a lot of work. Currently, the majority, not the majority, but a lot of disabled people are on the 1860 disability grant a month. A lot of parents for their children get the 1860 monthly grant. And I know COVID gave a little bit of extra, but that's also stopping the end of this month. 1,860 per family can do very little in terms of economically liberating that family. It doesn't even make them comfortable in their poverty. It just puts a veneer over it, kind of puts a plaster on the wound. But if you take that 1860, and you take 50 people in that community that gets the 1860, and they club it together. It means together, as 50 families, they have 93,000 Rand per month. And over a year, that's over R1 million a year. It gives you more power to buy. It gives you more power to invest. It gives you more power to innovate with. And I think we think this will happen by itself. Nobody is investing in assisting disability grant and care dependency grant recipients of how do we pool to actually get more. I think we must take cue from the initial self-help group of disabled people in the country, the first one, the Soweto Self-Help Association, SHAP, that Friday Mavuso and Tulani Chabalala and them started. They started SHAP by pooling their, I think it was 245 Rand or something, disability grant a month at the time. They took that entire grant over months and they put it away to be able to start off. Because they said, somehow we will survive. Some of them actually went to live in the hospital so that they get food. But they said, if we pool this, we have something to start up with. And I think the collective muscle of those grant recipients is it's like a gold stash that we are not really exploring with, that could possibly really contribute to economic liberation rather than just individual poverty. Thanks.
That was a lot. Do you have any comments, Zuki?
You know, Beauty, it's really complex. Because when you look at a non-disabled person against their counterparts, I think you can tell that the crux of what we're speaking about, both myself and Lydia, is that which she put as justice, which basically means fairness, and that can only happen when the playing field is level. So when you look at disabled people against their counterparts, they basically face additional barriers. So it is for, there's a need for an acknowledgement first that non-disabled people and disabled people are not on the same playing field. Once that is acknowledged, then equity measures are taken into consideration. Then we ask ourselves, why is it that this one is struggling, to work on an equal as their counterparts? Once we get those answers, then we can try and address the challenges that exist in there. So when it comes to disabled people, reasonable accommodation, which is what Lydia has alluded to, is very key, in the sense that it acknowledges that we're not equal, yet we're expected to do the same, to produce the same output, without starting from the same level. And yeah, I just want to confirm that I wanted to share that it is, when we think of economic participation, we tend to think of jobs, but there's a mindset also that disabled people cannot become employers. So I often ask myself, if employers cannot employ a disabled person beyond a switchboard operator job, would a procurement manager give a disabled consultant a job to actually run a particular project? So for me, the mindset is still playing a very big role in accepting that disabled people can participate. And we tend to still focus on the abilities, which are not in question, as opposed to seeing the environment as disabling and creating an enabling environment that can allow every single person to participate despite their differences.
I think,
sorry, if I could just link up with that last comment. And I think it's so important. When we look at the labor force reports every quarter, when they can't give us disability stats because lots of excuses, sample is too small and what have you. I've always said, if disability is the interaction between the environment and the person with the impairment, why do we insist on, when we do statistics, only count the people? Why do we not in the census, why do we not in our other statistical reports also count the number of buildings that's inaccessible, the number of websites that's inaccessible, the number of transport systems that are inaccessible? What's the cost differentiation in terms of, and the implications of that? Because when we start doing that, we will start addressing the real problem. So even as disabled people, we make that mistake. Disability organizations tend, when they go into conversations with Stats South Africa, focus on, but how many blind people are there? How many deaf people are there? How many, instead of saying, how many websites? How many, because it's as important as the impairment. The impairment's impact on the individual's life becomes less if the environment is fully accessible. But we insist not counting the inaccessibility of the environment.
Beauty, is Lydia still there?
Yes.
Yeah, what Lydia is saying is one of the things that I've always found to be so powerful, and it hardly crossed my mind, because I also was one of the people that focuses on the people. So we have to look at both sides, and say, and also do a count of the inaccessible buildings. But learning from the gender mainstreaming developments, right? There are gender inequality gaps. And Lydia, I've always wondered, I know we've started working on that. For me, I've always thought that, if we could probably do a robust exercise on the inequalities that exist amongst disabled people and non-disabled people in any sector, in this instance, be it in economic participation, which has attributes such as skills attainment, as you had mentioned earlier, and other attributes, I think that can form a very strong basis or a very strong case, for us to start moving forward. If we give a very clear indication that this is what the inequality looks like, which would be more of an objective way to try and get us moving forward. So unfortunately, there's been a lot more strides on gender inequality as opposed to the development of understanding the inequalities between disabled people and non-disabled people. So yeah, I don't know what you think about that.
You know, before I let maybe Lydia make a comment on that, I think, you know, I'm an occupational therapist, so, you know, economics and, you know, all of the things that you're talking about is not my strong point. But I think, you know, from the experience of working for an NGO in communities, I think firstly, you know, we don't often talk about how disability intersects with everything. It interacts with health, it interacts with education, da 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 da. And so we are often, or departments, organizations are often very purist in their approach in terms of their programs or, you know, things like that. And so even in some of the you know, the points that you guys are making, you know, my observation is that, you know, some of these problems are because of, you know, the lack of connectedness lens to disability and you know, the experiences of people with disabilities. So on that note, we have a question from Abongile Tini. I'm sorry if I said that wrong. And so Abongile says, how is it that the government hasn't realized that many specialized schools do not translate to mainstream, I think to seamless employment channels, even less so than other school types, that is private specialized schools, public and private mainstreams. Do you guys have comments on that?
Yes, and I'm going to answer it from a perspective that I think is not very popular in the sector. Because to a large extent, I blame the sector for that. And I blame parents in particular for that. I understand why they do what they do, but this is the impact that it has. Because parents fear for their children's mental well-being, because parents are told from birth that your child is special, your child deserves something separate. It is parents that often insist on special schools. That as government tried to phase special schools out, parents were the ones that insisted that it must remain. So that in itself is the first challenge, that we believe. And if you go to special schools, 80% of the children in special schools shouldn't be there. They have very little additional support needs. They could quite well cope within the community schools where their brothers and sisters go to. So that's the first aspect of it. So we're sending mixed messages to government around the issue of special schools. Are there special schools that do provide seamless entry into the employment market? Yes, there are. And those are special schools that where they cater for kids that can access open labor market quite easily, and they have the necessary support in place. They've ensured that their curriculum aligns with that so that it is possible. What they don't do so well is that they often do not provide those children with enough exposure to mainstream society and a non-protective environment, that when the kids leave there, they don't know how to cope. And that we typically see in our first years. There are schools for kids with intellectual disabilities that have made some of that transition to some extent. I think you have Grace and Hope in Limpopo. It's a rural school, and they couldn't live with the fact that they offer their children 12 years of education and a certificate that said he attended for 12 years, full stop. Nothing else. So they made the transition to move into the NQ, into the SAQA NQF environment. And they sent their teachers to become skills facilitators and skills moderators, etc. So when their kids now leave school, they have a level 1 or a level 2 in that stream, which then enables them to learn further. So there has been some progress, but as I say, to a large extent, you know, people are in their comfort zones. Why would I move out of my comfort zones unless something forces me? So it is a struggle that we've been struggling for 30 years with, and it just doesn't yield very fast results.
Yeah, you know, I think that you know, you know, when you started your response, you were talking about the role of parents and their pushing for, you know, this sort of nurturing of, you know, the children, and the answer to that being special schools. I think from, you know, an occupational science perspective, you know, we often talk about occupational possibilities, and how it's so difficult to want or speak about or think about, you know, things that you haven't seen as possible. And so, you know, I think part of, and I mean, I see this perspective all the time where parents don't know what is possible for their children, because there's a lack of representation. I mean, you know, we can talk about that in terms of media, in all sectors and scenarios. Actually, there's a lack of diverse representation and a lack of the, you know, a telling of diverse stories. Yeah.
You know what I wish for, Beauty, if I may come in. This has been one of my wishes, because I mean, you look at people like Lydia and Dr. Vuyo, who has just passed on, right? My issue is that we need to create knowledge, right? Meaning that there needs to be a lot more research. I wish there could be like a huge investment into research so that data can be available. When there's great credible data that is gathered and available, it can then inform our policies and programs so that we can work from a more informed position. I'm not saying that people are not informed. There are pockets of people, you know, like Lydia, who have got knowledge in their heads, you know, because institutional knowledge and people that have been in the sector. But if all of these are not documented and good practices are not documented, you know, it becomes difficult for us to create programs that are supposed to address the issues from a more informed position. So I do wish that there could be this huge chunk of money that could be put in, that could be invested into research on disability and not impairments. You know, a disability as a human rights issue, not impairments from the medical view. So yeah.
Suki, it comes back to your initial comments around attitudes. So much has been documented.
Yeah.
There are so many well-documented stories of good practice, of inclusive experiences, etc. But if your policymakers and implementers have an attitude of, we don't want that, we're not interested, we want to aim, we want to target our aspirations for disabled people as low as possible, we want to do as little as possible, you know, then they don't take it up. So it is actually amazing how much has been documented, but people are just not interested in learning from it because of the attitude that we don't aspire for seeing persons with disabilities as the CEO of companies, as the owners of companies, as the ministers. We always see them as recipients of goodwill, and you know, we will create the opportunities and decide if they should access it or not. And even then, the opportunities that we create that we think is for disabled people, the aspiration in terms of where it can take that person is really low.
So thanks, Lydia. That is indeed true that there's a lot that has been documented. So my documentation, I wish it can translate into curriculum, you know, because I look at practitioners as well. When companies look for someone an engineer, right? They look at their credentials. Does this person have the right credentials to do engineering work? when they look for an accountant, we look at the credentials. Does this person have some accounting background? But when it comes to disability, you know, well, it's not standardized as to what qualifications should that person have. So the documentation for me, I wish it could translate into curriculum that can be encouraged and learned, you know, in school to enable these people to become to work in transformation jobs in companies and focus on disability so that they can become champions in that regard. I mean, we do have disability studies that are offered by a couple of universities locally, but even then, you know, it's short courses or it's on a postgraduate level, not necessarily a full degree on disability studies.
Yeah. You know, I think that, you know, as you guys are talking, like a few things come up for me that, you know, although there's a lot of, you know, information and there's a lot of documentation and research is continuous, from, you know, what I've seen is that at a community level, there's often very little meaningful engagement with, you know, that information. And I mean, of course, you can talk about, you know, the politics of the ownership of knowledge, that once you've extracted knowledge from a community, who owns it? Because then that, you know, links to what can be done with it and who does the doing. And so I think for me, that is where the gap is. And I think even, you know, as an organization, we've realized that gap, that, you know, what good is research when it doesn't benefit the people that it came from? And, you know, and so even in you know, when I was in clinical practice doing ComServe, there's such a big gap in communication. I mean, we can even talk about COVID and, you know, the fact that we are post the levels of lockdown and some of us still don't know mask protocol. We are still wearing our masks below our nose. And we are still doing crazy things because there hasn't been adequate, meaningful communication, you know, about this. And then, you know, another point is the point of policymakers. And so who becomes a policymaker? And so the lack of diversity in leadership. I mean, from a health perspective, we are still, you know, sitting at a point in South Africa where majority of our hospital CEOs are either a doctor or nurse. So obviously the perspective that is going to be strong in their leadership is not a social model, but there's going to be a strong perspective of the medical model. And so that sort of infiltrates into society. This purist perspective of just because I have a degree in occupational therapy, I can't or I shouldn't, you know, widen my net and be a leader in whatever. Lydia, you look like you want to say something. Oh, you're on mute.
Sorry. No, I've just made a note in terms of solutions. I'm one of those people that for over 30 years, parents and disabled people have been telling us the same story because their lives don't change. So their stories remain the same. And unless we change narratives, unless we change the narratives of government as in response, and unless we change the narratives even of how we present our stories, we will not change anything. You can't add the same ingredients and expect a different cake. So for me, it's part of, so let's take, for example, the comments that you made earlier around, but how do we present parents with alternatives, with vision, with aspiration for their kids? And we combine that with technology available. Why is it that we don't have an initiative where we ask disabled people that have made it, that have gone through mainstream schooling, that have gone through special schooling, that have achieved. Why is it not that we do not have 3-minute videos in which they speak to parents of children with disabilities and say, Mom, this is what you must do to give your child a future? Because being disabled themselves, the parent will have a better ear than having people that don't understand that context. Why is it that for parents who want to be economically active, but they can't because they have a child that they have to care for? There are parents that have been successful in becoming economically active, successful with a child that they have to care for. Where are their stories? What is it that stops us from doing 2-3-minute videos that we can send via WhatsApp, that a therapist can show in the, in the clinic to a parent, where other parents can share and show it? And that's what we've got to start making people's stories accessible, because then you build a wave that says to policymakers, that says to therapists, service providers, frontline service providers, what you tell us is not good enough.
Mm.
This is possible. And then we might change the narrative.
Mm. Absolutely. Yeah, go ahead, Ziggy.
Yeah, I mean, Lydia makes a very valid point. You know, as human beings, we tend to believe what we see. So these stories, if they're more visible, then it tells us that it tells the whole society that everything that the sector and disability inclusion advocates have been speaking about can be a reality. You know, they say seeing is believing. You know, for example, did we know before, I may be getting the name wrong, but one of the musicians was a visual impairment. What's his name again?
Stevie Wonder.
Stevie Wonder. Would we have believed it before had we not seen Stevie Wonder? Is he a pianist? What is it? He's a pianist, right? Yeah, had we not seen him play the piano, that he actually can play the piano. So yeah, these stories, these success stories, if they're shared, you know, and they become visible, that's one of the ways that mindsets could actually change, as opposed to just telling them that do this can be done, you know. So yeah, and I think we also need to develop a lot more evidence, because a lot more evidence that shows, there's already evidence that shows that participation of a diverse group of people in any society can actually bring about innovation, can improve innovation, and actually make us a lot more competitive. So you look at the countries that are known to be in the top 20 of innovative countries. It's the UK, it's America, it's Japan, it's China. You know, it's where does Samsung come from again? That Asian country. South Korea. It's South Korea. They are known to be in the top when it comes to innovation. And then when you look at one of the things that they do have in common, what is it? A disability law. You know, I haven't done a deep study that shows that these two are related, but there is evidence that shows that if you don't include a certain group, if you don't include everyone, a diverse group of people in your in your activities, you know, you are not only robbing the people, but you are robbing the entire industry and the economy as a whole. So yeah, it baffles me why we would not want to actually include everyone, you know, because there can only be positives that come out of it. Yeah.
But Zuki, if you look at this, and you look at our discussion just prior to that around evidence, around what is it that people hear and see. Let's look at the issues around what's the value persons with disabilities add to the economy, add to the workplace. What's the narrative? If you go and Google it in a South African context, and you look at the narrative, it's about compliance, it's about cost, it's about burden, it's about being nice, it's about, wow, he actually did something. It's very little about what's the contribution that is made. there's very little appreciating that having a blind employee gets you an excellent logical thinker, because they compartmentalize everything to be able to remember. So the negotiation skills disabled people develop, the conflict management skills they develop, the tenacity, the resilience they have to. You do not see that as qualities, although those qualities are appreciated in the economy. They're not appreciated as qualities that disabled people bring to that economy and to that workplace. And that's why I'm saying we need to change narratives. We need to and unfortunately, for anything that we know and believe to be true, you need about 100 counter stories to start shifting your mind that that's not true. And that's what I mean with changing the narrative. We've got to start building new narrative that shows value and that doesn't show burden, because that's what people see.
Absolutely. We have 9 minutes left, and I think, before I ask you, the last question that I always ask everyone that comes onto this platform, is maybe, so, but I think we've also touched on it, like, what actually are the possibilities that exist for people with disabilities in terms of economic participation, or economic opportunities?
Sure. For me, I'm probably going to repeat myself, but the biggest hindrance for me is the mindset, because I believe that everything starts in the mind of that policymaker who writes that policy, the mind of that person who's supposed to implement the mindset of the person that's supposed to implement that. It's not an easy task to do, but I mean, Lydia has also got some suggestions, but that narrative, I'm repeating what Lydia has just said. That narrative really needs to change. And also another way that anyone can demonstrate their interest in any discourse is to actually putting money to it, a budget. So one of the ways that you can demonstrate that you are interested in seeing something happen is for a budget to be, resources to be put into that. So that activity, so
I want to throw it around a little bit of a change. I'm going to try and run very quickly through it. I know time is not on our side, and that's we looked at economic participation, we looked at economic empowerment, we look at economic opportunity, and there's another aspect for me, and Zuki introduced it when she said there's fairness that's required. And fairness is economic justice for me. And I know there's many formal definitions of economic justice, but I want to give a few examples of why do we accept? Why are we not insisting on changing the narrative? Why is it disabled people alone that's fighting this battle in terms of economic justice? And here's a few examples. Why do we allow the state to offset the cost of their failure onto individual households' pockets? The state fails to provide a wheelchair. The state fails to provide educational space, and it becomes the burden of the family to maintain, to buy, to provide. Why are we allowing it? Why are we allowing it that when you want to access social protection measures such as RDP, housing, disability grants, etc., there's a means test. Why are we allowing disabled people's household income to be compared to a non-disabled person's household income when we know what the cost of disability items is? Why is the cost of disability not factored in to determining what the actual equitable household income, disposable income is? Why do we allow SARS to only give us a 33% rebate on disability costs and not 100%? Who said 33? How did they come up with 33%? Why do we accept 33% and not 100%? Why, when we know that new jobs are going to be created in small micro enterprises, often are not part of the Employment Equity Act? Why are we allowing it that there's no disability subsidy for those enterprises to take in disabled people? They cannot afford the reasonable accommodation costs. If we can have a youth subsidy, why can't we have a disability reasonable accommodation support subsidy? So enable them to take in more disabled people. The disability grant, even though there's no policy behind it, but the fact that the assessment tool for the disability grant is linked to your ability to secure decent work. Why, when the minimum wage was announced, did nobody rise, did our negotiators at NEDLAC not rise and say, but if the disability grant has always been equated to work, why is the disability grant not now going to be matched with minimum wage? Similarly, the child support grant is a relatively new grant. Before that, children that are disabled had access to the care dependency grant to assist the parent with that care aspect. They then introduced the child support grant for food, for nutrition for the child. And they said, no, disabled children, you can't eat. We're giving you for care. You can't eat. You're not a child first. Why did we accept that there was no top up on the care dependency grant, or that the child could access both grants? Because we're basically saying to them, no, disabled children don't need to eat. Why are we accepting it? These are small changes that's logical, that's vested in economic justice, that can make huge differences to persons with disabilities and their families. The grant and aid, 400 Rand a month. It is for personal assistance. There's a minimum wage. So what, you're going to employ somebody legally and they can help you twice a week out of bed, and then you stay within the legal framework. Why is nobody challenging that? And then I want to link it with a question Rachel asked on the Facebook thing. What programs are there for her as a mom of a disabled child that needs care, that needs her attention? She can't take off work every time he needs to go to the hospital, etc. And my question is, why is that a disability sector issue? She's a woman. There are women empowerment programs. Why has moms of disabled kids not demanded that there are programs that respond to their specific context? There were programs developed for widows as women empowerment programs because widows had a specific issue. Why have we not seen women empowerment programs that specifically respond to the economic issues of moms of disabled kids? So for me, those are fundamental issues that we can address with relatively little effort, because a lot of these things, the precedents are there, the budgets are there. It's just a question of the mechanisms working for us.
Absolutely. Absolutely. You know, I think we have 2 more minutes. And I think for me, like with all that has been said, because a lot has been said, and I think I myself am even going to go back and rewatch this. But I really, you know, think that this conversation affirms the need for, you know, within healthcare, we call it intersectoral collaboration, and a moving away of this purist, divided approach to anything, and really, you know, seeing how, you know, because for the sake of our conversation, how disability intersects with everything. And so our approach cannot be, you know, simplistic and purist. And so, you know, I want to just ask you this one last question, that, you know, as individuals in the space that you are in, what are your hopes for South Africa in terms of this topic and going forward?
So like I said, I do dream of a fully fledged curriculum on disability studies in South Africa, where we can have professionals, right? Because the thing is, you'll find that even ourselves, people that are working in the disability sector, most of what we work on is based on personal experiences, as opposed to an understanding of the concept of disability and well researched information. So I find that even ourselves as disabled people, we don't seem to take disability seriously enough. We don't dream of doing disability studies to work in disability. We tend to think that just having the impairment qualifies us to give advice or any consultation on disability. So you'll find that we aspire to become engineers and still consult on disability. You know what I mean? For me, that's an indication of how seriously do we ourselves take the subject? Do we see it as a proper profession that one can actually, so if other people don't seem to do justice in it, I dream of a fully fledged curriculum and, you know, and young people being encouraged. I dream of seeing career guidance teachers going to schools and giving out pamphlets that encourage people to do disability studies, to do a degree on disability studies, so that they can become professionals, so that they can be the people that are employed in the disability unit, you know, at a university, that they can be employed in the transformation and diversity and inclusion units in a corporate, you know, as opposed to having empathy being the criteria. I'm not saying that that's what seems to be the case, because in most cases in corporates, you'll find that disability is just thrown into HR, you know, when they have not really gone deep into understanding disability. So a whole lot of injustice tends to come out of that. So yeah, that's my wish.
I think for me, whilst I concur with Zuki to some extent, I think from a mainstreaming perspective and looking at economy, very few disability studies offer economy as the core of that course. And what typically happens with disability activists, whether they're disabled themselves or not, they come from the social sector. And it links up with why is there this chasm. You said yourself, you're a therapist, you know very little of the economy. So you go to economists, you go to financial guys, and you speak social language, trying to convince them of the worthiness of somebody else, the abilities of somebody else. And they stop listening, they just don't hear us. I would really, for South Africa, to be really able to tap into the value and the contribution of disabled people. I want to see more Zukis, more disabled economists that is in the economy, that is able to translate the aspirations of disabled people into economic liberation. That's financials, that's bankiers, that's engineers, that's architects that really can grapple with the issue in large enough numbers to really take those sectors by heart and start removing the barriers in there. I think we need less social activists and more economic activists in terms of being able to infiltrate those sectors and change it from within.
Absolutely. Sure. This was a really amazing session. I myself have learned a lot. So I really, want to take this time to appreciate your contribution to this conversation. I think, when we started this platform, it's really, about what we're talking about today of, putting a different narrative out there and showing different possibilities, various possibilities that are available for people with disabilities and their families. And I really hope that from this conversation, that people were able to get a glimpse of that and so themselves, delve deeper and educate themselves and be in more conversations, and then hopefully that the conversations would lead to doing differently. So Lydia and Zuki, thank you so much for your time and your willingness to be here. I really appreciate it. Thank you.
Thank you so much, Beauty.
Thank you so much.
Thank you so much, Lydia.
Thanks, Zuki, and you guys keep doing what you're doing. We will get there.
We will.
The
Thank you
wheels
so
are
much.
turning, Lydia. They're just turning very slowly, but they're turning.
And they're not in reverse, nah.
Ooh, yes, I'm glad that they're not in reverse.
Yeah. All right.
Thank you so much, everyone. Bye.
Bye.